Hey everyone, I think I'll give it just a few more seconds as I can still see people joining. So I think if you want, we're not going to go around and do introductions at this meeting. We only do it, I think we do it about once a quarter. We check back in because we have new people join, and just to keep, have opportunity to be introduced. So if you could just put your name and your role or organization in the chat, that would be great, so people can look at that. As everyone is popping in. So I'm noticing on the agenda, we had updates in the beginning, and I know that AOE is going to do their they're going to do their update after First Children's Finance presentation, correct? Beth has things going on. Thank you for putting your names and your organizations in the chat. So I think we'll get started. The first part of the agenda is there is opportunity for updates. I think there may be an update from AOE that's going to be a little bit later in the agenda. Beth. Jackie, do you know? I think they're
Alyssa
is going to join us, I think, at 10:45-ish or 11.
Yeah, I was just reading her email again. I couldn't remember what time.
Okay, so I think that update is coming a little bit later.
Yeah, you'll have to make her a co-host because she's got like 2 slides to show.
Okay, got it. All right, thanks. And I didn't know if anyone from the Child Development Division had an update before we jump into the presentation, or you could share an update later in the meeting as well.
Yeah, let me think about it. And if anyone has specific questions, feel free to put them in the chat.
Thanks, Nicole. All right, so I think we'll get started. We have Heidi Hagel-Braid here with us from First Children's Finance. And we are going to spend the first part of the meeting hearing from Heidi, hearing about First Children's Finance, hearing about their plans for opening a Vermont state office and the work that they will be doing in Vermont. So I am going to turn it over to Heidi to start that presentation and discussion, and feel free to definitely be time for questions. You can throw questions in the chat as well, and we will be monitoring that. But thanks for being with us, Heidi, and we'll start with you.
Good morning, everyone. Nice to be with you this morning. I'm Heidi Hagel-Braid. I'm the Chief Program Officer at First Children's Finance. And I'm so happy to be with you all this morning and to see some faces and names together. I recognize quite a number of you now. I'm here because I want to introduce myself and our organization to you, and also tell you a little bit about our efforts in partnership with Let's Grow Kids to establish the Business Technical Assistance Program. And we were successfully awarded that RFP through a competitive process from CDD. And so I thought it would be helpful to just sort of talk about what that's going to look like and our presence in Vermont, and to introduce our organization to you and answer any questions that you might have. So I'll first start with just a little bit about us, and I'll drop our web page into the chat too, so you can grab that whenever you have a moment to take a look and learn a little bit more about us. Let's drop that in. So First Children's Finance is a national nonprofit organization. We're headquartered and founded in Minnesota in 1991. And our mission really is to build the sustainability and supply of excellent childcare. And we do that by focusing on the business side of childcare. We know that the first place to start is with families and kids, but very quickly after that, you need to pay attention to, at least in this country, the business side of childcare. And so our organization really was founded to be able to build the capacity of folks who are working inside of this field. We know that so many people are led to the early care and education field because of their heart, because of their desire to serve families and children. And they don't usually come to our field with a significant background in business. And it is imperative for the success and sustainability because childcare historically has been underfunded and has a very tricky business model. They're very slim profit margins. And so we're doing some of the most critical work in our country inside of childcare, and we're doing it on shoestring budgets. And so our organization has founded really to think about how to build the capacity of entrepreneurs to be able to run those businesses efficiently so that they can provide the best quality of care in the communities, making sure that they are providing care that's reflective of the community. And then also being able to weather storms, quite literally and figuratively, to their businesses. And we are recovering from one of the mightiest storms of all time in COVID. So we focus on serving 3 different audiences, and then I'll sort of like bring that back to what that means for Vermont. So first and foremost, we work with childcare entrepreneurs to build their capacity. We provide an entire slate of business services, including training, professional development, business consulting, technical assistance, and coaching. We also provide access to capital, and that is something that's available in many places in Vermont. It's not the primary reason we're coming to Vermont, but it is helpful to know that we are a CDFI, a community development financial institution, and we do provide access to capital to people who are trying to finance, start, or grow their businesses. So in that work, we come to it with a relationship-based professional development framework, really making sure that we are building the capacity of entrepreneurs, whether they are starting a home-based family childcare business, whether they are coming out of the classroom and taking over the director position of a childcare center, positioning a business for growth, dealing with a crisis, or starting brand new, or thinking about transitioning from unlicensed care to licensed care, from family childcare to a childcare center, taking over a nonprofit. All phases of business, we really work to build the capacity of people to do this work. And I think our philosophy is critical here, is that we are not doing anything for anyone. We're building their capacity to be able to do this work and to manage their businesses, keeping their missions and business vision in mind, so that they aren't reliant even on First Children's Finance, that we're building their capacity to do this work well and to carry this forward into the future. So that is really the major focus of all of our work with entrepreneurs. And that is the primary thing that we'll be bringing to Vermont. But I do want to tell you about other 2 pieces of our work. And one of them is our work in building supply with communities. So since the beginning of our founding back in the 90s, we've been working directly with communities to think about childcare as an economic development strategy, and really building the muscle of communities to support and grow the supply that's needed, especially in communities that have a shortage of childcare. So really taking from a local perspective, a deep dive into what are the conditions and factors on the ground that are inhibiting supply, and thinking creatively about the assets that a community has, both financial and non-financial, social capital, real capital, facilities, et cetera, and thinking about how to leverage those in sustainable ways that make a difference and boost the health and vibrancy of communities and the regional economy. Since 2013, we've been focused on rural childcare supply building in earnest. Doesn't mean that we have abandoned our work in urban communities, but back then we continue to utilize our expertise to help communities solve this problem, not just studying shortages and understanding the depth of them or the breadth of them, but to think about ways in which we can make a difference and build supply. So we have been doing that work for the entire founding of our organization. It's some of our most intriguing and interesting work, and you can always learn more on our website as well. And then finally, the last part of our work focuses on systems. And systems for us include state government, federal government, and tribal government. It would include territorial government, but we don't have any engagements around territorial government at the moment. And then sometimes with very large counties or large cities who are thinking about systemic ways to address the business side of childcare. And so thinking about what are the elements that need to be in that ecosystem to make sure that there is a supply of sustainable childcare to meet the needs of the goals of that system, whether that is making sure low-income kids have access to childcare or building sustainability or increasing supply that might have been lost during the pandemic, thinking about it from a systemic level. And what we do is take everything that we know on the ground from real-time key performance indicator data from childcare businesses and blending that with everything we know about the needs, desires, challenges, and successes at the community level, and help systems to think differently and innovatively about the levers that they have to push and pull, how they can think differently about funding streams and what they might be utilized for, how to blend, braid, and leverage and innovate inside of those funding streams, and to really think about supporting businesses and through investments, policy, and funding mechanisms that hopefully make a difference at the bottom line of childcare businesses over time. So again, all of that is sort of wrapped up into our mission and our work. We have soon to be four state offices in Minnesota, Michigan, and Iowa. And we'll be launching our new state office in Vermont in the coming year. So it's a very exciting time for us. We are thrilled to have been invited to and funded in Vermont, and are looking forward to bringing our services and our organization to serve Vermonters and to be good partners to you inside of the early care and education sector. So we have relationships in 4 states where we have state offices that are led by a director. Our search for a Vermont director is ongoing right now. We'll be adding staff in the new year. And we also have an entire staff of people who work across the country as well. So, and in addition to where our 4 offices are, we have engagements and relationships with 20 different states at any given time, and currently 4 Native nations, working on all kinds of things from on the ground business support to childcare entrepreneurs, all the way up to thinking about how to leverage subsidy in new and different ways to make sure that businesses are participating. That's a project that's happening in Alaska. We're working in Wisconsin with 28 different communities to build strategic supply plans for individual communities to think about strategic visions and leveraging assets to build supply where it's needed most. So we have our hands in lots of different projects across the country, and that really helps us to be able to bring local expertise and national reach to the places where we do this work. And so we're very excited to be a part of the delivery plan for childcare businesses in Vermont. And I want to make sure that you know that we try really hard to stay in our lane. We are not the quality people. We are not the people who are doing all of the things. We are really narrowly focused on supply and sustainability of childcare businesses and the business issues that are impacting childcare. So we're great partners to those of you who are working on workforce compensation, who are thinking about how to leverage capacity building inside of the state, and partners in those of you who are lending capital to childcare businesses. We pride ourselves on being a source of financing for low and moderate income borrowers, particularly women and women of color who may struggle to access capital in other places. And we're really skilled at being able to bring our resources to the table in the ways that are needed most, whether that's bridge financing or gap financing, or just being a partner way down the list in, seventh position sometimes on loans. We're okay with that because we really want to be a good partner to those of you who are doing that work. So let me just kind of tip into what the BTAP, the Business Technical Assistance Program, will look like in Vermont. I'm going to talk about that. But before I do, please feel free to drop any questions into the chat that might be top of mind at the moment. And then I'll try to grab those, and then I'll talk a little bit about what's on tap for the BTAP, and then open it up for any questions that you have. So we applied for and were successfully awarded the RFP for the Business Technical Assistance Program. And we actually submitted that proposal in partnership with LGK, Let's Grow Kids. We've been partnered with them for a couple of years already, providing some limited services on the ground in Vermont. But our philosophy and approach to this work is very much aligned, and they are great partners in thinking about what the future could look like for business support to childcare businesses in Vermont. So as part of that proposal to the state, what we have proposed to do and what we're working to sort of launch is the Business Technical Assistance Program. We haven't thought of a better name, so for the time being, that's what it's going to be called. And it will be FCS state office. We will hire Vermonters and bring all of the resources to bear of our programs and services at First Children's Finance. So what people can expect from the Business Technical Assistance Program is that childcare businesses in Vermont will be able to access services by a lot of different methodologies. They might contact LGK, they might contact us directly, they might come through the shared services platform. They could come to you as a partner or a leader of this sector in Vermont. So that's why we're hoping to tell you a little bit about it so that you at least can say, hey, you should go find those folks over at LGK or First Children's Finance. We want to make sure that all of the folks in Vermont who want business support have access to it. Programs and services are provided at no cost to participants. And so there is a sort of a range of services that really are set up based on the time commitment from the child care entrepreneur or business leader that is participating. And I should just say, when I say entrepreneur, that's kind of a catch-all term for anybody who's leading a nonprofit organization, a family-based program. It's just kind of a one big term that is inclusive of everyone. So they could access anything from a very short-term training or series of trainings, workshops, or seminars, all the way to engaging in a group cohort of entrepreneurs that are similar or facing a similar struggle. Maybe that is building supply through an addition or growth of the program or second location or any kind of growth of slots. It might be someone who is looking to rebuild enrollment. It might be a group of entrepreneurs who are trying to rebuild from the pandemic and some of the end of financial investments from the federal and state governments. How are they going to sustain as the landscape shifts again? All the way down to individual consultation. So we have financial analysis tools that are proprietary to our organization that we've built over time that allow childcare businesses to not just look at financial information, but to do a complete analysis of the performance of their business, which is really critical for home-based providers who might not be using a financial system at all. And so it's a way for us to help them to get another view of their business, think about what needs to change, where there are opportunities for improvement, and then help them to sort of set a course for the future of how they can grow or sustain or solve a challenge that they're encountering currently. So really, those trainings are very short-term investment, and those consulting projects that are individual one-on-one opportunities are a great way for folks to have confidential advice, coaching, consultation, and technical assistance. And of course, that is at the other end of the spectrum of the investment of their time and the time of First Children's Finance staff and our partners. So, and there's a lot of things in between there. Anything that you see on our website will eventually be available in Vermont. We are not lending capital right out of the gate, but all of the business services focused towards the financial operation and management of childcare businesses are absolutely available. The Business Technical Assistance Program is really focused on childcare entrepreneurs. That's the audience that it's facing. So there won't be, out of the gate any community work that's there. All of that is something that we do. It isn't part of the Business Technical Assistance Program. So you can really think about any time that an entrepreneur or a childcare business leader comes to you with a challenge that seems like it might be out of reach of what your programs and services might be focused on. They're a great place to send to us at First Children's Finance. In the coming weeks, you'll see our website will have populated contacts for Vermont, who are the staff people there, and how can they get in touch with us. In the meantime, if you have a burning question, concern, or someone that you know needs assistance, you can always reach out to LGK or to myself in the meantime as we start to staff up and launch. The BTAP, the Business Technical Assistance Program, will sort of like officially launch in January of 2023. And we'll be inviting you to learn more about it as it launches, but really want to make sure that you know that there is no wrong door. There's not a complicated process. If people are looking for us or trying to connect to us, there isn't a wrong way to find us. And so I just want to confirm that anyone that you send to us, we will make sure to first and foremost treat with respect. It's the underlying philosophy of how we do all our work. We will meet them where they are without blame, shame, or judgment, and meet them with a willingness and excitement to help them discover where they want to go and give them the resources that they need to get there in a variety of different ways. And we hope that as we add our staff in Vermont, that you will have a chance to meet them and to get to know us, and that we'll be able to be wonderful collaborators in the future. With that, I'm going to open it up for questions in case anyone would like to know more about a particular issue. Please just feel free to take yourself off mute and jump right in.
This sounds really exciting. Thank you for sharing, and I really appreciate your enthusiasm and how you emphasized that people will be welcomed without judgment and with enthusiasm. So thank you for that. I was curious if any of the services would include helping folks who don't have experience with grant writing to learn how to secure their own grant funding outside of loans.
Yeah, we have an entire catalog of training, and it's focused on all kinds of different core competencies, and we separate them by types of businesses. So there are 8 of them that stay constant across family childcare, a for-profit childcare center and for a nonprofit childcare center. But the thing that you just touched on, Holly, is that nonprofit childcare centers have two extra areas of concern. One is board governance and the other is fund development. And so we have some trainings and some services that are focused specifically on nonprofit childcare centers or entities. They might not always be a childcare center where fund development is part of the picture. And so that is part of the offerings that we are available to provide through a couple of different ways, definitely through training and also through consultation as well.
Jim Chmarkey here, Director of Planning for Southwest Vermont Healthcare. Heidi, this is great. I love the fact that you're bringing a business angle to our childcare centers. We so need that in order to make sure that we're sustainable. On your website, you have a grant opportunity. It looks like it's funded by the Minnesota Department of Human Services. The period opens here coming up in towards the end of January. Is that eligible? Are Vermont childcare centers eligible for that grant funding or not?
Unfortunately, no, Jim. Excellent question. It is something that I think is a fabulous opportunity that certainly might be a good fit for Vermont in the future. But it is only at this point, because it's funded by the Minnesota Department of Human Services, only eligible to license programs in that state. But we're hoping to grow that work, so stay tuned. I will drop my contact information into the chat, but I appreciate just the time to be able to connect with you this morning and tell you a little bit about our work and welcome you to let us know if you have any questions. If you'd like a more formal presentation to just your organization, please reach out. I'd be happy to meet with you and your teams to answer any questions or concerns or requests for information that you might have. And without any other questions, I'll pass it back to you, Sherry.
Thank you, Heidi. I know some of you have had the opportunity to meet with Heidi. And again, if you would like a more one-on-one for yourself or your organization, we're happy to do that. Heidi's been doing the Zoom tour of Vermont and was here in person at the end of October and got to meet some of the folks in Vermont that we anticipate First Children's Finance will be working with or will be a resource for childcare programs looking for those types of services. A couple things I just wanted to mention. We're really excited. As Heidi said, we've been working with First Children's Finance. First started communicating with them in 2018, and then they helped us with a project that was focused in the Northeast Kingdom around providing childcare business training. So we've had this, it's a great opportunity. Really excited that they were the successful bidder for the RFA. And also a key strategy, as most of you know, or do know, but might have forgot, Let's Grow Kids sunsets in 2025. So many of the gaps that we have been filling are related to some of these aspects of running a childcare business, and look forward to the opportunity to not just leave a gap when we exit in 2025, but to have some time to overlap and build a sustainable system for that kind of resource and support for childcare businesses. So feeling really excited and I guess I would say really calm about that opportunity, because thinking about the services that Let's Grow Kids has been able to provide related to entrepreneurship and fiscal stability, and thinking of that just ending with no plan did not feel like a sustainable situation for childcare programs in Vermont. So really happy that childcare, or the Child Development Division, also recognized that as a need in the system and supported that through that RFA process. So it's great to have First Children's Finance as a partner and opening up the fourth one, right, Heidi? Not the fifth, fourth office in Vermont. So I'm going to, if you don't have any other, this is like last call for First Children's Finance. Because I think that Heidi is going to pop off after this.
I just want to say
Okay.
thank you, Heidi, for joining us. It's great to put a face to a name, and hopefully you'll be a regular around this table, or whoever is hired to be the state director. This group can be a resource to open other doors if you need them.
Thank you, Beth.
Awesome. Great. So we started the meeting a little bit early, so we're kind of on a fast track here. I think what I'm going to do is shift up the agenda a little bit and ask, because Cheryle Wilcox couldn't join us before 11. I think what we'll do is have, where did Jen H go? She flipped around. Jen Horowitz give us an update. She was scheduled for later in the meeting, a policy agenda update from Let's Grow Kids. And we'll stop that a little before 11 because we do have some AOE updates. We have an individual joining us to do part of that. And then give CDD another opportunity as well. So we'll start with Jen. So go for it, Jen.
Thanks, Sherry. Morning, everybody. Some of you have seen the Let's Grow Kids policy agenda for 2023 in various iterations. The kind of non-update update is, it is still evolving. It's not the end of 2022 yet. We're still finalizing all of the language. But this morning I wanted to go over the latest version of the agenda with all of you, just to see if anyone has any additional pieces of key feedback or questions about what we are planning for 2023. So I can go ahead, I'm going to go ahead and share my other screen, and I'm going to look at that while we're talking at various points. So if I'm not looking directly at you and you have a question, I haven't seen your hand raised, please feel free to interrupt me and chime in. I will do my best to kind of bob my head back and forth between my screens. So I'm going to go ahead and get this shared. My Zoom is a little slow this morning, so just give me a moment. Sorry, hopefully you can all see it, but my controls are still deciding if they're going to pop back up, so I can do anything with my screen right now. Okay, perfect. There we go. So as I was saying, that we've been working on this with a variety of partners over the last several months, and we kind of are focusing on a couple of key areas. So for our 2023 agenda, we are focused on transforming childcare financial assistance program, really supporting different quality initiatives related to the workforce. We're also thinking about governance and financing, so we're going to kind of run through all of those pretty quickly. I'm not going to go super deep into the weeds, so if you have any questions, and I think many of you know me, I have like workbooks upon workbooks that go into each of these things. Happy to answer those questions offline if there isn't enough time this morning, and I'll pop my email in the chat in case there are any more of those like super deep in the weeds questions. But this morning, really just going to gloss through some of the higher level takeaways. So the first thing that we're focused on is really taking what was set out in H171 the other year, now Act 45, around the goals of family affordability, and thinking about how could we continue to transform Vermont's childcare financial assistance program to achieve that goal. So what we're proposing is a 4-year transformation plan for childcare financial assistance so that we are expanding program eligibility, increasing the benefit available to families, and basically getting to a point in 4 years where we have a near universal version of childcare financial assistance that ensures that no family in Vermont spends more than 10% of their income on childcare. So part of that is transforming what the sliding scale looks like. and really making sure that we have something that is progressive, where we have something that families can easily access it, wanting to put in resources based on the successes of the Burlington Early Learning Initiative to ensure that families of color and families that have been historically underserved by the program have increased supports to ensure that they're able to enroll in CCFAP successfully, and really making sure that we are providing financial support through childcare financial assistance that reimburses programs based on cost of care, so that programs are getting the financial resources they need in order to offer quality childcare. So it's both expansion of the program to include many, many, many more families, increasing the benefit for families, ensuring that programs are compensated in a way that allows them to cover all of their expenses, inclusive of compensation for early childhood educators that includes increased wages and access to benefits. And we can talk a little bit more about that piece, the compensation piece, in just a moment. So that's the snapshot of CCFAP changes. I'm going to try and run through these, but if you have questions, throw them in the chat, let me know, and I'll try and go through everything once I've run through the agenda. The next key part of our legislative agenda for 2023 is thinking about how do we better support Vermont's early childhood education workforce. So in 2023, we want to increase wages in some way. The technical term that we use here is still evolving. We've been in consultation with partners at the tax department, with other states, trying to think about how can we basically get funds to early childhood educators in a way that's approximately equivalent to a $1 an hour wage increase. I'm not saying that's exactly what it is when we're running the math on the back end. That's kind of the formula I am using. But in some way that it is increasing early childhood educator compensation, whether you call them bonuses or a compensation increase benefit. We're trying to work through the technicalities so that we can get the terminology right. I'm trying to see if there's a way to make it so that it is not taxable by Vermont. It probably would still be taxable by federal government, but this term is going to, my basic takeaway is it's funding for early childhood educators to increase their compensation. The technical term that we end up using in the final language is still evolving. It will probably be different than anything I have said thus far, but there will be a term. It's basically a way to get more funding to early childhood educators to increase their take-home pay at the end of the year. So stay tuned for final terminology, TBD. The other thing that we are asking for is the Vermont Student Loan Repayment Support Program has a great advisory group, and they are have been looking at how the program has been operating, as led by Vermont AUIC, and have made some recommendations on how to kind of make some technical fixes to the program in order to ensure more early childhood educators have access to the program. So in our agenda, we're basically saying, these are the recommendations. This is how we can strengthen the program. Please do this. We also want to increase funding for Teach so that it can continue to expand. Since there are people waiting to have access to the program, we want to make sure that we don't have wait lists and the program is able to meet existing needs. We also want to do the same for the pre-apprenticeship program. And we also want to ensure that there are some financial resources available to the Vermont Early Childhood Higher Education Consortium. So those are the 2023 pieces. In 2024, based on Vermont's Advancing as a Profession work, there will be a list of different initiatives that will be put forward. So 2023 is really setting some foundational pieces in place and making sure we're ready for those 2024 asks when they come, which will include minimum compensation standards, things related to professional preparation standards, and aligning workforce supports with kind of the program changes that are proposed. Another big focus is on supporting children with specialized needs in childcare programs. This component is still in the works with various different partners, but the idea is to strengthen special accommodation grants, rethink the program so that there are funds available both to meet individual child needs, as well as just general financial resources available to programs to do things like training or quality coaching or shared resources. But kind of through these conversations, it really, a key theme is, yes, we need specific child needs. There are some children that require, let's say, very specific durable medical equipment. We need to be able to purchase those things, but we also need these bigger resources that are beyond a single child. And so we want to make sure there's funding available for both of those things, and that we're leveraging existing systems and resources in order to help distribute funds and have it be a process that's not prohibitive for programs or families. So right now there's that 6-month eligibility window. We want to expand that to a full year, so you're not having to reassess after 6 months, and that we're really streamlining the process so that it's not this burdensome, really prohibitive paperwork thing, and that we can make it as easy and user-friendly as possible. I'm not saying we can eliminate all the barriers, but try and streamline as much as possible. Thinking about quality improvement, we're still monitoring what's going on with STARS evolution. If there's anything that needs a policy solution, we have space kind of set aside and saved for advocating for that. Same with capacity development. As First Children's Finance kind of is launching their work, if we see any particular needs that need a legislative solution or specific policy changes, we'll be monitoring that and may include something related to those pieces. The final two pieces are governance and system financing. So with governance, there was the systems analysis report that came out that really recommended that there is a single empowered leader in state government who can oversee Vermont's early childhood system. So we are taking that recommendation and moving it forward. And then in terms of system financing, I think as everyone in this meeting knows, the RAND study is underway. They are going to be recommending, how do we finance a system moving forward that's providing financial resources that are long-term and sustainable, and also kind of thinking about what is the cost we need to be working towards and thinking about as we consider those financing mechanisms. So once the RAND report comes out, we'll be able to add those last two pieces. So that was very fast. Happy to answer questions. The thing I will say too is that this is our legislative agenda that we're putting forward, that we have crafted in partnership with many of you and many different organizations. Families have advised us as well. We have offered this to members of the legislature. They're going to create a piece of legislation based on their interpretations of this and their own ideas. So what may come out in legislation may look different than this. I just want to kind of preface that. You know, they have put in the hard work to be elected. They're going to share their own ideas. We're really going to be looking to see what that comes out to in the next several weeks as the legislative session gets started. So let's see, I'm going to stop my share.
There is one question in the chat.
So the document we're sharing, so this is a current draft. As soon as we have language finalized, it will be going up on our website and it will be available. This is a draft that I can send around via email, but it's not posted yet since it's still currently evolving.
We can send it with the notes, Jen.
Perfect. Thank you, Sherry.
Oh, and there was a second, have we calculated the cost? There was a second part of that.
Thank you for the first platform you discussed.
Yeah, Jen, Jim Schmarke, you may have answered that, and that it's waiting for the RAND report. So yeah. So thank you, Sherry. Appreciate it.
Okay.
Yes, RAND is running that calculation and thinking about. So while and I think this is an important clarification, the RAND study is looking at what would the cost be in a future system. point in time. What we're proposing is a 4-year phase-in to get to that point. The RAND study will not include kind of a phased-in financing estimate. They're just going to look at, if we do all these things, then the cost, we anticipate the cost will be X. So one of the things that we're trying to do is think about like what that might look like on the back end, but when RAND releases their report, it will just be the kind of point in time once we've achieved a future system, what will the cost associated with that be?
Any other questions for Jen?
I just have a very quick comment that we submitted a grant and we had some snafus with the fillable PDFs and all of the forms, and the folks on that end of the receiving were just so gracious and helpful, and it was a really good experience. So I just wanted to pass that on.
All right. Thanks, Jen.
Yeah, thanks.
And I think we will now move to AOE and CDD updates. And I'll start with Nicole. Nicole, is there anything that you wanted to share? I know we asked you quickly in the beginning, but didn't really give you time. Is there any other updates before we shift to the AOE team?
I can give a couple little quick ones. So Becca Webb asked in the chat about some clarification around a communication that just went out around the RFGA, which is request for grant application for SPARKS, which is the acronym for the quality supports. So it's System for Program Access to Resources for Quality Supports, SPARKS. And I think, and anyone jump in if you're hearing similar things, that there have been a few programs that were a little bit confused about, like, is this the application to get quality supports, or is this the application to get the grant? And so it's not a request for grant application for individual programs. It's actually a request for grant application for someone to run that program, for an agency organization to run that program. So I can put, just in case anyone's interested in looking at it, or they don't still have that email, I can put the link to the actual posting for the RFGA in the chat, just so you can reference it. The communication didn't go into great detail, but there are more details on that site. So that's just one thing I wanted to touch on. If anyone has questions about that, feel free to let me know. In the kind of policy brief that Jen just went over, that reminded me to just give an update on where we're at with STARS promulgation and what that looks like. Right now, we are in the process of kind of having the proposal reviewed by legal and preparing a presentation that was in I think it was in the budget build last year, just a presentation on STARS for the legislature that kind of touches high level on all of the areas that we talked about and planned through within the stakeholder group. So I'm also going to put another link in the chat to our revision webpage that has all that information and all the recordings, all of the kind of like desk aids for people to be able to see that. And preschool development grant, we should know by the end of the month if Vermont is getting it. I don't really have an update, except we're supposed to know by the end of the month. That's what I have.
Thank you, Nicole.
Yes.
Great. So I think we will shift now. I think Alyssa joined us. I thought I saw her name. There she is. Let's see her name. So I think I'll shift to Alyssa and Jackie, and there might be some others that are going to share early MTSS update with us. And then at 11, we will shift as Cheryle Wilcox joins us to talk about mental health and crisis supports and services for families.
Great. I'm going to share my screen. Thanks for having me. My name is Alyssa Rausch, and I am out of the University of Denver, but I am a consultant with the Pyramid Model Consortium, and I am supporting the Vermont Early MTSS team in supporting sort of the state leadership team work. And so I wanted to just hop on today. It sounds like perhaps the team will have a little bit more time in January, but I wanted just to talk and give just a quick overview around what's happening. So this is a model that was developed by the AOE team, which really demonstrates sort of how all these pieces work together and what the role of the state leadership team for early MTSS will be, really around ensuring, monitoring, and advising, and then using both data and available resources, including training, coaching, all of those sorts of things to build a statewide scale-up model for early MTSS and ensure implementation and sustainability. This graphic demonstrates sort of how all these pieces look across the system. So one of the things that we start with on the ground is really related to what are the practices that are happening in the classroom. And we know that that's a really important piece of delivering services to children and families throughout Vermont. What we know is that that's only one piece of this, right? In order for that to happen, all these other pieces have to be brought into place. So we really need to be at thinking about sustainability and scale up, and what is the role of each of these sort of levels and groups at each of these levels. And so what you see here is over here on the right is really the state leadership team. This is what they're sort of overseeing at all of these different levels. The next piece really gets to sort of how we look at getting to meaningful outcomes, is really thinking about that, again, just driving home that idea that we do need to have effective and socially valid practices. Like that's something that needs to be happening in classrooms and will be happening with implementation sites, but that we also need to be thinking about the implementation itself. So what supports, processes, infrastructure is in place to make all of that happen? And what are the ways in which we're supporting implementation? One of the ways in which implementation is being supported is through the cross-sector state leadership team, there to ensure, monitor, and advise. And that this is what we know is the recipe for meaningful outcomes. So really thinking not just about, again, practices getting into the hands of providers and delivered in classrooms is one piece of that, but really growing and scaling it up and making sure that it's being equitable distributed statewide is the role of the state leadership team. So just a little snapshot of the implementation sites themselves. These are the 8 programs that are implementation that are beginning implementation, and the current state leadership team does have some representation from these sites on it. Again, a quick snapshot that is a mix of public and privately funded programs. They are across the state. And each of the programs is developing an early childhood leadership team. So really thinking about the capacity of the program, not just to work on this in one classroom, but to really look at it. What does this look like program wide? How could we expand it in a center or a district across lots of programs? So they're developing their own implementation teams that are happening within those programs. And then also, these are the programs that will be getting professional development and coaching, so training and coaching as part of the deliverables from Pyramid Model Consortium as well as Pyramid 802. This is, these are just a couple of screen grabs of the implementation sort of events planned for 2022 and 2023. So they really do cover what are we doing around supporting leadership teams? What are we doing around implementation of programs? And then how are we supporting coaches? And that's in addition to sort of what are we actually training folks on, right? So practice-based coaching, prevent, teach, reinforce for young children, which is sort of the tertiary top tier individualized support for children with behavior that is perceived to be severe and persistent, challenging behavior. And then also trauma-informed care. So this is just a few of the things that are happening. And again, what you see is a representation of practices, like how are we really supporting providers to do these practices, but then also how are we providing training that's looking at the sustainability and scale up ability of this work in Vermont. So the training events really actually cover both of those spectrums. So you can see this is just a couple of so some of the very early evaluation that we've been doing is we just have a couple of screen grabs of this as well. So you can see here sort of who these initial trainings, this initial training, and I'm not even sure exactly which training this was, but you can see the representation of who's there and what are they doing, and then what is sort of their experience within the field. And what you see is a pretty significant range here. And so we've had a lot of, there's been a lot of reach in terms of reaching people in different roles as well as in different levels of experience. Some of the things that we'll do over time is rate the quality, usefulness, and relevance of the work itself, of the trainings themselves. So this is, again, just the kind of evaluations that you'll be seeing come through. And you see here that what's been assessed so far has been quite useful. And then finally, what we want to be able to really look at is what are the skill sets that providers are gaining knowledge in, right? So really thinking about what are these practices that best support early MTSS in Vermont and are associated with the pyramid model. What sorts of gains are we making, and to what extent is training being supportive? And then we'll use these data, if you remember in the models that we showed, to really help to say, this is more training that we need. This is the type of coaching supports that would most be helpful. This is what's really sticking for providers and they're being able to do this. And this is what we're still finding some gaps in. So we'll use these data, or these type of data, to really work with planning and implementation supports moving forward. I know that was a lot, and I know I only had 5 minutes, so I want to allow you all to move on with your time. And again, we'll see you in 2023, but are there any questions, pertinent questions that I could answer now that are rising for anyone?
This would be also a great opportunity to share anything that you hope that they can cover in more detail when they do come. Hopefully January date will work for all. So think about that.
I have a question about the coaching, Alyssa, fellow Alyssa. I was wondering, are they like generalists or are they specialists? What's their training?
Jackie, do you want to take this one?
Yeah, I'll take that. So there are 2 different coaching that we do, and there's the practice-based coaching within the program itself. So you're basically working with one teacher's classroom and coaching them. And all of us that are doing that have been trained actually by the Pyramid Model Consortium in order to be able to do that. The other coach is for the leadership teams. And what we do there is we support the group of people that hopefully will help with that sustainability and and build up. And we're also trained by national trainers in order to be able to be a systems or leadership coach in order to do that. And our role there is more facilitation and discussing who should be on this team, how do we want to move forward, what are your plans as we go through an inventory together as a team. Does that help, Alyssa?
Yeah, so it's all folks like generally within early ed who are then trained by Early MTSS.
Correct. Mhm.
But there's two levels of coaching, and we'll get into that. Again, as Jackie said, one is really focused on implementation and one is really focused on practices, right? So really thinking about how do you build the capacity of all of those coaches to really be able to do both those things to move early MTSS forward.
And one of the goals for this training of this whole grant cycle that we're in is to have each of the implementation sites that we're working with to identify someone that could be a coach within their either SU, their program, or someone, you know, in another, someone that they see on a regular basis that could do that. And also being trained as a systems coach so that they don't have to pay someone else to come in and do this, that there would be someone either in that region or that program that could do that.
We'll take a
Meg?
Meg's question. Yes, Meg's question, and then Cheryle has joined us and we'll transition to Cheryle Wilcox. Thanks, Meg. Meg, we can't hear you. Oh, okay, she's going to put her question in the chat. So we'll just give her a minute. I bet she's a very quick typer.
Again, thank you so much for having us, and we'll be able to unpack a lot more of this in January.
So while we're waiting for that, Alyssa and Jackie, did anyone forward you the invitation for January? So I can at least get it on your calendar. I can do that.
I have it as a January 12th, correct?
Yep. Yes. Yes. Thanks. And I will be in touch with both of you to shore all that up. And there's the question in the chat.
Thanks, Sherry.
Did you want to take it, Alyssa, or you want me to?
Jackie, do you want to take this question? I'm sorry, I said thanks, Sherry, and my Siri came on. So I'm wondering how a larger group of programs can be supported by the coaching. Yeah. So, Jackie, do you want to take this, or would you like for me to sort of talk about it?
Well,
Go
if
ahead.
I miss anything, you can add into it. What our goal is has always been is to make sure that we can get the different people trained to be coaches, either in their programs or in their region, to do that. And that's one of the things that Pyramid 802 Plus is now doing. We are now training coaches to be able to do this work. And it's practice-based coaching, which can be used for any kind of coaching you want. But when we do the training, we focus that training on the pyramid model practices. So that's one way we're doing it separate from this grant, is making sure that we're just pulling more people in to do coaching. And the plans for expansion of the coaching model will go through this grant with the training that's being offered. And I have to tell you that if you take this, it's great, because I had to pay for mine all the time at NTA, and these are all free with the national trainers to come in and do this training. So take advantage of it if you can, because it's a wonderful opportunity and the trainers are exceptional. So that's it's twofold. It's through the grant, and then hopefully as we move forward, there'll be more sustainability for more training of coaches for both in the classroom and in the leadership piece. I hope that answers it, Meg. Okay.
And Jackie, if there's anything you want us to send out in the notes, just send that to me. If there's any links or anything like that, Jackie and Alyssa.
Yeah, I can do that. I'll send out the flyer for registering for these trainings that are coming up.
So,
And Alyssa, I see your question there. We'll get that addressed in January as well.
perfect. I was gonna say
Thank
that,
you.
and any other, Alyssa or anyone else, if you have other questions just based on this really short presentation that you got that you want to make sure that the team is planning for when they come back for a longer period of time in January, let me know and I will make sure they get the information. Great. So Cheryle, there's Cheryle. Cheryle, welcome. Right on time. You joined us. So we are going to now turn over the conversation to be led by Cheryle Wilcox, and she's going to talk to us about mental health and crisis supports and services for young children and their families. So welcome, Cheryle.
Thank you so much. Can you all hear me okay? Lovely. My mute's not showing up because it's on my phone and it's a whole lovely thing. So for those of you I haven't met, I work for the Department of Mental Health. I'm the Interagency Planning Director, which means that I do a lot of work across our different departments at the Agency of Human Services. I used to solely be focused on the children's system of care. I now do the whole scope of ages up to adults. And I have some data and information to show you that it's hot off the press. So you're actually the first group that is seeing this. You'll see it show up in a couple different places, publications. I know Building Bright Futures in State of Vermont Children. Some of this you will see there. Some of it you will also see in our system of care plan that our state interagency team publishes. But I actually wondered, and I know I have until 11:30, so I want to be cognizant of time, but I don't know everyone, and I don't know if there is a way to quickly get a read on who's here.
So Cheryle, we do have more time because we flipped some of the agenda. So I don't know that you have more time, but I just wanted to not make you feel
Okay.
rushed.
Thank you.
Sure. And you weren't here. We put our names, and so let's, do you want us just to go quickly through?
Names in chat are great, if that's
Okay, if you
quick and
could, so
easy.
let's do that. Let's, because Cheryle wasn't here when we did that earlier, so she can't see our former chat. So if you could put your name and your organization or role.
And
in the
Cheryle,
chat.
just from a very high perspective, we have kind of a range of people in different positions, from people who are running programs in public and private programs, advocacy, Head Start, Let's Grow Kids, Agency of Education, Early MTSS. So it is actually a pretty representative. Not as like, I don't see any educators, people who are in classrooms specifically on the call. So it is mostly like people who are managing programs.
And there were a few early childhood educators who either had to leave early or couldn't come today, but we record it and they did express they were interested in watching that. So.
Okay, great. Thank you. That was really helpful. Sorry for asking you all to type in when you did that earlier today. So I appreciate that. It looks like I can share my screen. Is that true? Tell me if you can see that.
Yes.
How about that? Always still amazed. Let's see if I can. Now I'm looking at different screens. All right, is that working too? Do you see the like full screen? Because I have a presenter view thing going on. Does that work for all of you? I can send this.
Yes.
Thank you, Beth. I can send this, Barry, if I send it to you, is that okay? And then, okay. So I have worked, let's see, I'm a social worker by trade. I've worked in the mental health field for almost 25 years now, which is always stunning to say that year. I was just on another meeting where people were talking about birthdays, and next year is 50 for me. So that feels a little odd to be at that point. So the very adorable child you see is my son, who is now almost 19. So that gives you a read on kind of where life has moved for me. So I'm wondering, and folks definitely unmute and say it out loud or put it in the chat, but just kind of frame like what you think is the most important thing that you do to support children and their families' mental health. That's a great one. Help schools create safer, more predictable environments for all students. Your resource. So interesting. My son, who you see here, definitely had sensory and like would get overwhelmed and anxious. And his school, when he was in elementary school, stopped having all of the kids go to the cafeteria in the morning, which was super loud, super overstimulating, and they would have them go to their classrooms. And it was amazing to see that shift for all the students, like just to a calmer beginning. I often think of kids too taking the bus and how loud it is and what that means, and how when you make environmental changes, it really helps all kids. Access to other supports. Building resilience, that's a really great one. So please feel free to keep putting things in the chat. I think, you know, one of the things I will say at the Department of Mental Health, we've been talking about for years. I've been in my current role for 8 years now. And although my position has shifted over time, the core continues to be interagency supports and how things link better together. Like we know that families sometimes need supports for mental health, and if their child has a developmental disability, they may be interacting with that part of our division. And if families are struggling with substances, they may be interacting with our division of substance use, which folks probably used to be called ADAP, alcohol and drug abuse programs, and shifted the past few months to division of substance use. So if you hear that, same thing, same division, just different name. But really how those can link more closely together, because with the differences and the different ways folks can get support, it can be really confusing. And I tend to get calls from families when they are at the point where clearly I don't get calls for people saying like, oh, this all worked perfectly and great and we're all set. It very much is more like we're struggling to figure out where we access services, because there are different entry points, and our divisions at the Agency of Human Services have different funding streams. Those come siloed through the legislature. So us trying to make them work more streamlined for families is something we're always challenged by and working harder at. So just wanting to make sure that, you know, it is on the forefront of our mind, and that we're doing a lot of language shift of mental health being part of health. And so not separating out physical and mental health, because we know, and certainly all of you working with young children interacting know, you know, often we'll hear kids say they have stomach aches or headaches or other things when they're stressed. And those are real things, and it's coming from a real place based on how their mind and body is interacting, just as that happens for us as adults. Special accommodation grants, that's another great way to support children. So those are all ways that I think we all come into play with this, and important that all the different roles we have are an important way of looking at supports for children. So this is the data that was just recently updated a couple weeks ago. It's fiscal year data. And so our designated agencies, which are designated through statute to provide mental health services, designated agencies do mental health services and developmental disability services. And so they're funded through our Department of Mental Health, and then also through our Department of Disabilities, Aging and Independent Living. So this is the number of children being served by our designated agencies per children under 9. So you can see the line of how it's shifted. I will say you'll see the dip in 2022. I will tell you we have seen a dip across our system, and none of us think that's because people don't need services. I will show you some workforce data, which is pretty indicative of the challenge of, we know children are struggling more, and families, and we have a workforce crisis which you can see here, which is about our vacancies. So these vacancies, just so you know, this is mental health and developmental service workers at our agencies. So just 3 years ago, there were 441 vacancies, and we're now over 1,000 at the highest point. These have been pulled more than annually. You can see the dates at the bottom. We've been pulling it more than annually because there is a workforce task force that I co-chair with one of our designated agencies. We've been meeting for 1.5 years now to do work on recruitment and retention. We've provided funding to help staff with tuition reimbursement or loan repayment. So thinking a lot of this is definitely true for mental health, a lot of our folks to be able to bill Medicaid need either a master's degree or you need someone signing off that has a master's degree. And with those degrees comes a lot of student loan debt. So being able to help staff with that. We also see folks going into other sectors like hospitals or private providers, private agencies, because they can make more than a community mental health agency. And it's true, a lot of us spent years working in a mental health agency. I worked for Howard Center for almost 8 years as a school social worker at Edmonds Middle School. And it is amazing clinical experience, and I got great supervision, learned a tremendous amount. And then folks either reach a point where the direct services, and you all know this from directly working with kids and families every day, it's really intense and there's pretty high burnout. And so folks shift to other roles or move so that they're still involved in the field, but not directly doing that work. So this, looking at this workforce data, I think folks have probably seen a lot in the media around the Great Resignation. Folks are, what we've seen in the past with social workers and mental health work is folks may leave and stay in that sector and do different jobs. What we're seeing more of is people leaving the field altogether to do something completely different because they're exhausted and are having their own struggles, their children or families, and really need to be moving out of the field to take care of themselves. So wanted to share this data because it really puts a lot of pieces in perspective of what we have been managing. So you saw the decrease in the number of children being served by designated agencies, which we definitely think is a piece of workforce. And we have seen an increase in the number of children under 9 accessing crisis services through their designated agency. So again, like when there isn't enough workforce, often what we've seen is that we're not able to support families earlier. And so then they reach a point where they're in crisis and needing supports. Especially true of the pandemic that we've been going through. I was talking to someone yesterday who said, at this point, we should be assuming every child has trauma from the pandemic. And certainly when we think about smaller, younger children, not being able to be in their early care and learning setting, not being able to be with peers, when that is such a rich time to be learning and developing and growing and what that means. So I don't mean to paint a doom and gloom picture, but definitely wanted to share data and give you information. And then also be able to share what supports are available, because I know there was also interest in mental health supports. This is my guy, Patrick, again, now at 8, with our dog, who is now elderly dog. And I would say, when I think about different supports that are available, getting our dog was definitely an intervention for both my son and I at the time of going through some hard things at that age for him. And just really that support and being able to have a dog who is, you're getting up for and you're walking and you're taking care of and getting that unconditional love. And I think there are lots of things that we all do every day when we're acting with children and families, and then also to think about what there are a number, when I think intervention, I don't think an hour therapy session. I think there are a lot of ways that children and families get support and connection across the spectrum of being outside, being with pets, being with other people and connecting. Within our mental health system, there is therapy supports. And there's been some really great new ones. So when I talk about some of these, I'll say outpatient therapy is available at every designated agency across the state. There are some newer therapies like parent-child interaction therapy and child-parent psychotherapy that are evidence-based, that are at certain designated agencies. And that's just been because the training is pretty intensive. And so having that support and the staff time, especially when we start talking about turnover of staff, like there's definitely a loss of some of that information. But that, you know, the great things about these two therapies are that the outcomes have been shown to be really successful with families. So parent-child interaction therapy, if you haven't heard about it, you know, I think back, so I started as a social worker in child protection, and there used to be, you know, the way supervised visits were done were with the two-way mirror, which luckily we've moved away from, which, you know, you just were observing and writing notes. Not very helpful in coaching, depending on how you were having conversation after. This has a two-way mirror, not to observe, but the parent has an earbud, and then the therapist can help them by coaching while they're interacting with their child and parenting. And I often think when I heard about this, I was like, oh, that would have been really helpful. Like for me as a parent with a young child, when you're just like, I don't know what to say or do next. And so it's live in the moment. Like here are some things you could say, here's how you could manage this. And the folks doing this, our agencies, have shared outcomes with just families feeling so supported, and that it was so helpful and really in a positive way, making change and helping families. So there are supports and services like that. And then also supports obviously in homes. So not that, you know, we know with young children, like trying to just, if you even have a car, like getting your child in the car going somewhere, it is and can be challenging. And especially when you think about crisis, like when people say like, oh, put your child in a car and meet us somewhere, like that is just not realistic when a child's in crisis, and who wants to put them in a car that's then going to be moving, which can increase danger for everyone. So also home-based services. So being able to go to someone's home if that's what they're needing. There has been more, I think folks probably know like crisis services you can call, but the Department of Mental Health is putting out more funds to fund more mobile outreach, being exactly like the parent calls, they say what the crisis is. There's no screening of like, oh, it sounds like maybe this is a behavior, or, oh, maybe there's this. It's the parent saying it's a crisis. They know what a crisis is. Someone is going out and meeting with them to help them in the moment. So really trying to get more of those supports out into communities so that folks have access to that and aren't just waiting or being told to meet in the emergency department, which I will tell you, we are working really hard to not have kids go to the emergency department. It's not good for anyone of any age. I mean, certainly for anyone who's been there for a physical health problem, like it can be traumatic and stressful because of everything going on. But when we think of children and then putting them into sensory overload in the emergency department where there's loud noises and beeping, and it is not a place that, it's not an environment that's helpful. So really saving the emergency department for really the highest level crisis, but being able to see families. And even if there needs to be a mental health screening, that does not have to happen in the emergency department. It can happen in a home, and there can be a plan to then determine, you know, if a child does meet the level of needing more supports and services. I think for a long time, people have thought the emergency department was the only way to access that. Or, you know, crisis workers were so overwhelmed. And so if you have 3 calls at a time, you may be saying to someone, meet in the emergency department, because then you can go there. There are other people. It does provide that ability to have others around to help. But whenever we can, we don't want to see folks in the emergency department who are in mental health crisis. We also, I talked about mobile response. There's been a pilot in the Rutland region for a little over a year now. It was funding through the legislature based on advocacy from the Department of Mental Health saying, you know, this is something that has been helpful in other states. We don't want to wait until we have a tragedy or horrible things happen in Vermont. Like, we need to be meeting parents where they're at. And the other part of mobile response is also having a peer be a part of that team. So there's a clinician going out, but also, whenever possible, teaming with a peer. So a family who has lived experience, who also knows what it was like. And I think, you know, for many folks, being able to talk to someone that's been through it is really helpful. And I will say, as an adoptive mom, like, I have access services throughout the years, but often the most helpful thing I have found are other adoptive parents who can say, yep, totally get it, like, understand where that is and the nuances involved. And so I think it's another piece of really recognizing that peers and family members with lived experience can offer something that, as a professional, it's a different intervention and support. So really wanting to be investing in that and supporting that. And then also having places other than EDs where folks can go. So in Bennington County, the United Counseling Service of Bennington, which is their designated agency, set up a couple of years ago. It's like, you would think of, it's not an ED, but it is a building, it's a place, and they have sensory room and activities for kids. And it's a physical place the family can go, so that, I'm hoping you all can still hear me because it looks like my call dropped. Okay. So really being able to, if you can go somewhere, to have a place, and then also different rooms, so that, like, the child is in a quiet place and they're getting support, the family can be there, and it can be something that also can be set up to be more proactive when kids are struggling. So it's another nice way of having support. So that's another thing that is going on. And, you know, I think the hard thing about the pandemic was everything we lived through, and it means that we're getting additional federal funds flowing through our department. So we actually just put out, you know, I talked about our request for proposal for more mobile outreach. There was another one we put out so that folks can stand up more alternatives to emergency departments. So that can be physical places, like what Bennington has done through their psychiatric urgent care for kids. So by next calendar year, I would say spring, summer, we're going to start seeing more programs set up, and possibly more places like the PUC program, where families can go when their children are struggling, to have supports around them that is not the emergency department. There also are crisis placements. So there are a number of places where children of different ages can go if they can't be at home safely, and they don't need to be hospitalized, but it's a place that's not a hospital. It's a different kind of program where they're getting support 24 hours a day, 7 days a week. Right now, folks probably know the Brattleboro Retreat is our only inpatient hospitalization for children, and DMH is actually working to try to stand up another inpatient for youth in Vermont, because relying on just one hospital and one region in Vermont is hard for families. So that's more work that is going on. And then there are also our residential treatment places when things reach that level of the child not being able to live at home. And, you know, I feel like we used to talk about residential placements for teenagers, older children, and we have young children that are also placed in residential, which is not what anyone wants. And there are times when short-term residential placement can be really helpful for families and for children, so that families are getting to breathe, getting a break, getting supports, and so is their child. And then also, and there will be a link in the presentation I send around coordinated service plans. So that's another way of getting everyone in the team together to really coordinate what's going on, so everyone's on the same page and the parent isn't having 15 conversations with 15 different people, but all in one place. What are we all doing, and how do we come together? That was a lot of information, and I probably talked much too quickly. But I want to pause and take a breath and see if there are questions about any of that before I move on.
Oh, looks like Meg Jim had a question. It's in the chat. I don't know if you can, I don't know if you could, I can read it. Is there any consideration of relaxing the master's degree requirement to address the workforce shortage and increase access to mental health care, particularly for low acuity non-crisis? Doing so under practice guidelines model could improve access.
Yeah, absolutely. It's such a good point. There are some services that for bachelor's degrees or even with developmental services, they have a different billing mechanism. And so it may not reach the high threshold of needing a master's, but there is for certain services like therapy or certain intensive services that has to be supervised and signed off on by someone with a master's. And then treatment plans actually also have to be signed off on by a psychiatrist. And it is definitely, it's an insurance threshold. So some of these are things we have worked to be flexible wherever we can. And there's been work in Vermont around folks that maybe aren't licensed, but can be rostered like on this list until they get their license. They're still supervised, but it enables other people to provide support, similar to if we had someone doing an internship and they may not have their master's degree or be licensed, which is kind of the next piece after getting a master's. So there are ways we have figured out when we can of folks with different levels of experience. But then there are some thresholds that insurance says, like, you have to have someone signing off on this that has a license as a clinician or a psychiatrist. And so those are the places where, again, like when we talk about workforce, it's why we have advocated and gotten funding to help with loan repayment and other things that, you know, you go along. Certainly it's just true for me. Like I went, got my master's, got licensed, and then you have all your lovely student debt while you're working for a mental health agency where you're, you know, no one goes into this field similar to your field to be millionaires. And so it's really a matter of how do we balance some of those requirements and support people so that then they have a livable wage. Matt, I can see your hand up.
Yeah, thanks. I just think it's an interesting point that Jim raises, that we're hearing in many different sectors. I'm, as folks know, I'm the lobbyist here, not the clinician, but just I would observe sort of atmospherically that there are a lot of professions, a lot of service delivery areas where people are saying, well, can't we just like letting people work in classrooms who are retirees or who don't have a teaching license? You know, it's whether it's in childcare or pre-K through 12. And there's this question about quality and safety. And I just can't help but wonder, given the Great Resignation and the other issues we have all the way across the workforce, if we might come to some point as a society or in a larger economic question, what do we do about this? It's interesting to think about this as part of a larger question that may evolve or develop as opposed to in silos within individual sectors. So it's just an observation. I don't know, it's not going anywhere. It's just interesting to think it could be something larger occurring.
Yeah, I think it's a great point. And it, you know, it also, you know, I know, Matt, you as the lobbyist, which is great that you're a lobbyist and you're here, because we all sit in different seats where we can then bring these issues up from where we sit and say, like, here are things that could help, and understanding the full scope. Like I heard you talk about, you know, are there ways to relax and still make sure there's safety and quality, which is always the piece that we're trying to manage. And I will say some of the people I've worked with who are the best with kids didn't have a license, didn't have a master's degree, didn't have a bachelor's degree, like just life experience and that ability to connect. So I think there is value across the board, and what folks bring to the table and how we think about that is really important. Jim, I saw your hand, and then I see Heather's hand.
Yeah, Cheryl, just to extend the conversation just a little bit, just thinking about it. I mean, your 1,000-person workforce shortage. Now, recruiting makes a lot of sense, and it seems like, okay, yeah, we're short 1,000, we'll recruit from somewhere, but every state, every community across the nation is facing a mental health tsunami And therefore, these people are not willing, are not going to move to Vermont from Connecticut or New Jersey, because in New Jersey, they have plenty of work too. So we're going to have to grow our own. And the reality of the matter is growing 1,000 mental health providers, particularly the majority of them with a master's degree, is just simply an intractable goal. I just don't see how that's possible. I'm not trying to pick on you or pick on the current framework. It just seems like that's unusual to me. So I'm also wondering whether or not there's any appetite to start thinking about non-human tools. So AI chatbots. So for example, there's a whole suite now coming out in the mental health world of AI chatbots that can handle low acuity situations, particularly in families and off hours and weekends and holidays, when actually a lot of people have crises, but counselors, even if we had the 1,000 people available, they're not going to be available at 11 o'clock at night on a Friday night. So I just want to encourage the Department of Mental Health to think more broadly beyond just the workforce and master's prepared workforce in particular.
Yeah, I appreciate that, Jim. Thank you. I think, yeah, when I look at those numbers and think, how do we find 1,000 people? It is hard to imagine. I think we also have done a lot of investment in retention. We had some funding again, where direct service workers who have been in their positions have been able to get additional pay for staying and for being there. I think, we talk about recruitment, but we just as much need to pay attention to retention and supporting the folks that are there. I think also, I don't know how many folks saw last night on the WCAX News, there was a story about UVM Health Network and some of their practices where they have embedded mental health folks who can do some of that low level, like how do we support someone who comes in for an appointment, and really understanding the physical and mental health connection, so that also referrals for higher needs can go to places like our community mental health agencies. And then also having 988, the number, go national. We have folks in Vermont that 24/7 can answer calls, and that there are a couple different agencies doing that, and it's also been really helpful so that folks have immediate connection. But I appreciate, I think, knowing our demographics in Vermont and workforce issues in every sector, not just mental health. I think we always need to be thinking about other creative ways to get people what they need. Heather, I see your hand.
To unmute. Yeah, I mean, I kind of just wanted to echo a little bit of what I think Matt might have been getting at it too. So I know personally, so I'm from Vermont AUIC, so I have an early education background, but I've intersected a lot and personally know quite a few people that work in the mental health field. And I do see so many parallels as far as the staffing, and especially now. And yes, I agree, it's definitely across every workforce. But mental health, I just wanted to say, is one of the fields I think that also holds up all other fields, and the lack of wages and benefits. I'm watching people I personally know go through that and grapple with, should I leave the field or should I not leave the field? So I was just curious if there was like a longer term, like how to grow our own wages and benefits movement or thinking, or I don't know if there's any of that going on in the mental health field, because I just see that that's something that's going to have to happen at some point to help the field. And then I was just curious about like if there's any talk of opening up insurance for families, because I know like a lot of, at least I'm from the Rutland area, and a lot of the available mental health services are Medicaid only. And so there's, families that have other insurances have an awful time trying to access any services.
Yeah. So both your questions, the workforce piece, I'm actually going to send all of you the most recent strategic plan. It has a lot more data in it, but it also has all the strategies because there are pieces around livable wage and other aspects that we're focused on. I think, you know, part of the piece of the DMH gets their budget from the legislature. And so Medicaid can be billed, but we have to have the state match for billing. And so this past session, there was actually an 8% increase for mental health. And so we were able to give our providers an 8% increase in Medicaid rates. I am not saying that was enough given the cost of living and other challenges going on, but I think there has been recognition of what faces folks and what the needs are. So I can send the workforce plan. It's a public document, obviously. It actually got used in the legislature last session to say, like, here are the challenges, here's the data, here's what we're seeing and where we need to make investments. So it's been really helpful for all of us to think that through together. The group is made up of designated agencies, but also almost every department at the Agency of Human Services, because we rely on our mental health agencies for mental health and developmental disabilities and for substance use from a lot of them. So that's the first piece. And I should have written down the second piece of what you said because it was in my mind, but as I started talking, it went away.
No, I mean, it's unrelated and you might not have an answer, but yeah, I'm always curious about the insurance because I just see people
that
don't have Medicaid and they just call around and hit dead ends and there's such an insurance issue.
Yeah. So there's some work we've been doing with the Department of Financial Regulation, which oversees insurers and private insurances. You're right, private insurers, there are certain things they don't cover that Medicaid does. So things like case management and some of the community support, some residential programming. So there is another mechanism to apply for Medicaid. It's called Katie Beckett, which is outside of the economic pieces that usually come into play with Medicaid. So you can apply for that, like when a family has these needs and their private insurance isn't covering. But I think we've also been doing advocacy with private insurers because we also don't want Medicaid to be covering things that private insurers we feel like should be part of the scope of health and mental health supports that folks have the ability or need for those. It's not an easy answer. I wish I had a better answer. We have been working on it and meeting with folks to try to move that needle. So I also, have up, and you can look at it more. Beth Truzansky and I together a while back, a couple of years ago, it feels like 10 years ago because of the pandemic, had a group come together to talk about early childhood and family mental health. And so there's a link to the report and then recommendations for how to really support young children and their families, which I think is an important resource for folks to know about and to be able to look at that and see if there are pieces in it that would also be helpful. It's also interesting, I mean, when folks put in the chat how you're supporting children and families' mental health, a lot of these things got mentioned, which, the recommendations were not a big surprise. It was based on a lot of discussion of how do we do this together and really talk about children's mental health. So I know I'm over now by quite a bit, and I know you had flexibility, Cheryle, but I also don't want to eat up all your time. And so folks can always reach out. My email's on the PowerPoint, and I'm happy to answer other questions or have conversations.
Cheryle, I just really appreciate you coming. I see you at other tables, but we don't see you here often. And yet I feel like you've been an incredible advocate, and showing up in ways that really show that, the early childhood space and the mental health space need to be integrated, right? And so that is your life's work. I understand that, but I think for other people to understand, because I think there's so many people on this call who really care share that commitment to kind of building, the preventions, right? The social emotional development and supporting families, basic needs and all of those pieces, so that then when they get into learning spaces, that they can function and they can engage and also know where to go when we all struggle at times. So thank you for kind of giving us that overview here. I think it's really important. And, I think it's also really cool that we have really prioritized trying to make these systems as integrated as possible.
Great.
Yes, thank you, Cheryl. I agree with all of that. It was a great presentation. Appreciate you taking the time to come and talk with us about that. And I think it's a very, I think there'll be some follow-up, and just, for me, I just started thinking about just a lot of different aspects of what you shared. And it was interesting hearing some of the different projects in certain areas they're trying. That's a really interesting concept to me too. So thank you for all of that. And it's just a beginning of an integrated discussion that continues, I think, throughout all of our discussions. And I had told, I attended a national meeting for public health and childcare, kind of the connection. And there was a preliminary study that Yale was doing around stress and the early education workforce. And they had split it into like teaching staff, classroom staff, and direct providers and administrators. And the number one stressor above their wages, above like their own well-being for the administrators in the preliminary data was not having access to the resources for their families and children when they need them. So there's, it's also so connected and so important. So thank you.
Great. Thanks for having me. I appreciate it.
Does anyone have any other updates they want to share before we go? I will say next month we have Dr. Katie Northey coming from UVM. She has collaborated with Let's Grow Kids to do a study looking at Vermont early childhood preparation pathways, the student perspectives. She's diving into what supports, challenges, what she learned in terms of, looking at those preparation pathways, which we hope will help us, understand more about workforce preparation and how we might grow the early education workforce. And the team for Early MTSS will come back and dive a little bit deeper and give us more opportunity for questions. So again, if you have any specific questions, we caught Alyssa's question, but if any of you have thoughts or questions to send ahead of time so they're prepared, that would be great. Any other updates before we go? All right, well, thank you all for attending, and have a great rest of your December, and we'll see you on January sometime. Is it the 12th? Something like that. Sometime in January, the second Thursday in January. Bye, everyone.
Thank you.